If you have Medicaid, Medicare, or any health insurance, what I'm about to tell you could change your life forever. A massive bill is moving through Congress right now that could strip healthcare away from over 7 million Americans, and you might be one of them. Stay with me because this affects you. What's up, everyone? The Senate is literally debating the One Big Beautiful Bill Act as we speak, and the mainstream media isn't telling you the whole story. This isn't just politics. This is about your family's healthcare, your parents' Medicare, and whether you can afford to get sick. Let's break down exactly what this means for real people. First, let's get the facts straight. The One Big Beautiful Bill Act is a massive budget reconciliation bill that's supposed to fund President Trump's domestic priorities. But here's the catch. It's paying for those priorities by making huge cuts to healthcare programs. We're talking about $625 billion in cuts to Medicaid alone over the next 10 years. The Congressional Budget Office, that's the nonpartisan group that analyzes these bills, says 7.6 million people will lose their health insurance by 2034. But who are these people? Medicaid recipients who can't meet new work requirements, older adults and people with disabilities who will face more red tape trying to get Medicare assistance, people in states that help undocumented immigrants, those states will get less federal funding. Think about it, that's more people than the entire population of Virginia losing their health care. Here's what they're not telling you in the headlines. New work requirements. If you're on Medicaid, you might have to prove you're working or looking for work just to keep your health care. Sounds reasonable, right? But what if you're taking care of a sick family member? What if you're between jobs? What if you have a disability that isn't obvious? Now, about Medicare red tape, the bill stops something called streamlining Medicaid eligibility and enrollment rules. That's basically government speak for, we're making it harder for seniors and disabled people to get help paying for Medicare. And then there are state funding cuts. States that use their own money to help undocumented immigrants will get less federal matching funds. That means either higher state taxes or fewer services for everyone. Even if you're not on Medicaid or Medicare right now, this affects you. Emergency rooms will see more uninsured patients, driving up costs for everyone. Your state taxes might go up to make up for lost federal funding. Your employer's health insurance could get more expensive as hospitals shift costs. Your family members on Medicare might struggle more to get assistance. And here's the scary part. If you ever lose your job or face a medical emergency, these safety nets might not be there for you. This isn't some hypothetical future bill. The Senate is debating this right now. It already passed the House, and Republicans are pushing for final passage this summer. Some provisions might get modified because Senate rules are complex, but the core cuts are likely to stay. Look, whether you support this bill or oppose it, you need to stay informed because this will affect your life. Hit that comment button and tell me, do you think work requirements for Medicaid are fair, or do they hurt people who need help most? Are you worried about losing coverage, or do you think these cuts are necessary? I read every single comment. Share this video with your friends and family, especially if they're on Medicare or Medicaid. They need to know what's coming. And subscribe with notifications on because I'm going to keep tracking this bill as it moves through Congress. You'll get updates the moment anything changes, not when the mainstream media decides to cover it. This is your healthcare we're talking about. Don't let other people make decisions about your life without you knowing what's happening. I'll see you in the next one.